Okay, y'all, back to our poll. We asked, should Texas shut down non-essential businesses again? It looks like an overwhelming majority of those of you who voted, 83-ish%, say yeah, shut it down. Okay, thank you for voting. Now, as we do each Friday, I want to bring in our medical expert, Dr. David Winter from Baylor Scott & White Health, to answer some great questions that folks have had for me throughout the week. Good morning, Dr. Winter. Good to see you.
Good morning, Sonia. Good to see you.
So let's start off first with the new research that's out about masks. Can you explain what that was?
Well, you know, it's been a long time coming. We've always thought masks were helpful, but the official report was that they were most important for folks who have the virus. Now we know it's important for folks who don't have the virus also. When you combine two people like that, the incidence of virus transmission goes down 72% in this recent study. So everyone needs to wear a mask. Wherever you are, just assume somebody out there has the virus. If you're going to walk by them, wear a mask for everyone, no matter how healthy you think that you are, Sonia.
Okay, I'm going to go down this list of questions. One from Facebook. What are your thoughts on colleges and students going to school?
Well, I worry about that. Education, I think, is better in the classroom. I get that, but we need to have distancing, wear masks, disinfect your hands. I'm not sure that students are that inclined to do that, unfortunately. If we can reinforce that and get the teachers to reinforce this, yes, that's the best way to educate kids. But anytime you're in a close, confined space with people, that's the way the virus is spread, Sonia.
And there's a little bit of a difference between the younger, sort of elementary-aged kids and the college students, right, in terms of transmission?
Yeah, the younger kids, you don't even know if they have it. The transmission is less from studies. The kids don't seem to get sick. Now, rare cases they do get sick, but most kids don't get sick, the younger folks, but they can still transmit it. So that's still a problem with the young kids.
Okay, here's another one. I had COVID and I'm 26 weeks pregnant. I feel good now, but is there any effect on my baby?
The good news is this has been looked at a lot. Last time I checked the numbers, there were almost 1 million pregnancies around the world, and almost all those did fine. A few incidents where the kids got it, and the infants, when they come out, if they have it, they tend to do well also. So most of those mothers are going to do very, very well. I would reassure anyone who's pregnant not to worry about that.
Okay. I'd like to know, this is our next question, how long can you be around someone who is positive for COVID-19 before you catch it yourself? I imagine this answer would vary.
Yeah, it does quite a bit. Imagine somebody coughs a big cloud of virus out there. Well, you're going to get that right away. But in normal conversation, studies have shown if you're next to somebody who has very mild symptoms or no symptoms, 15 minutes is the number. Now that can be 15 different 1-minute intervals over a 24-hour period. So 15 minutes total exposure to a low level of virus, you can get it that way, supposedly, Sonia.
Now, there's been a lot of news about vaccines as well as an antibody treatment that I've talked about on Daybreak this whole week. Here's a good question from a Twitter follower. An earlier study showed a 50% drop in antibodies in 40 days. What's the drop-off rate of that study today, and what's the drop-off rate of the first and second studies of the current vaccine trials?
It's a great question. How long are you immune is a question. If you've had it, how long are you immune? Well, earlier studies said maybe 9 months, maybe 12 months. The biggest, largest study to date said, no, 3 months and the antibodies go away. They go away quicker if you're older. They last longer if you're younger. So 3 months max. I wouldn't be assumed that in those 3 months you aren't immune right then. You may not be. So be careful with that. How long vaccine is going to last? We don't know that. Maybe 4 months, maybe 6 months, hopefully a year. Further studies will tell us that later.
And then what about if you get a positive test even after 14 days, do you go back to resuming normal life or do you stay quarantined?
Yeah, that's a tough question to answer. The official answer is that if your symptoms are declining, and you've had no fever for at least a day, some will say 3 days, then you are not contagious. Now, some of those folks still have a positive test. We don't think those folks are contagious. In fact, we're not encouraging testing. Then if your symptoms are declining and you have no fever, then you are not contagious. But some of those folks have a test that's positive for a long, long time, and we don't quite know what to do with those right now, Sonia.
Okay, I know these are tough questions. I have one more quickly that I want to get to from a nurse. I wonder what the new onset mental illness rate is in the general population during these times. Does it match the 1 in 5 cited in COVID patients? So basically, all the mental illness that we're seeing, does it have more to do with COVID or more to do with just 2020 in general?
Yeah, well, both. The answer is yes, both. But folks that have been sick with COVID, especially folks that go into the ICU, have a high rate of anxiety, depression. Imagine this, you're in a room, confined to a room, can't see your family, your friends. All the healthcare workers walk around in spacesuits. Scary, depressing. Those folks have a condition now. You've heard of post-traumatic stress syndrome. New condition, post-intensive care syndrome for those folks. And we're seeing a lot of those people, Sonia.
Okay, Dr. Winter, thank you so much for your time as always. We'll see you next week.